Yeah, good morning, everyone. Uh, there was some internet problem because of that it was not the class was not streaming, and I was giving a lecture for the last 18 minutes, and later on, right now, I got the information that the class was not streaming. So 18 minutes already I started my class at 11 o'clock. 18 minutes already I took the class, and now it is again. I don't know how much you were logged in, you got the connection or not, but I'll start again. I'll try to start again. I just lost the flow. Anyway, hi everyone. My name is Dr. Pawan Kumar Sharma, Professor of Community Medicine. uh, you guys may have seen me or may not have seen me, but welcome to the college. Welcome to the to our department, and we will be teaching you for next 3 years. So community medicine is spread out in all the 3 years of your curriculum. Okay, so I already discussed a lot when I started how the community medicine is and what community medicine is. I'll not go to that again, and I'll be little brief because already I lost 20 minutes. Okay, so yeah, so when we talk about health, so my topic is health system in India, and when we talk about health system, I'll be little faster. Okay, when we talk about health system in India, it works on three important bases. Like there are three bases for any health system in any of the country, even for the world. The whole health system is based on three things: prevention, cure, and rehabilitation. So when we talk about prevention, prevention is like, for example, if you get so prevention is like the country's policies is based on that they do not want anybody to get sick. So there can be infectious diseases, non-infectious diseases, or other health conditions like disability. So if people acquire this, they are sick. If they don't acquire any disease, they are not sick. So I'm going back again to my this thing. It's difficult to catch up the flow. Right. So for example, if somebody do not have any disease, right? And the population do not have any disease. Like for example, 1 year back there was no pandemic, there was no COVID-19, there was no disease like that, and suddenly the pandemic came in. So government policies and health system had to take severe measures to curb the infection. And there, again, you can have three example right with the same pandemic, that the people who did not acquire the disease should not acquire the disease, and if the steps are taken in that direction, those steps are taken into those steps fall under preventive steps. So it works on preventive model. Then the second model is curative model. Like for example, curative means You are sitting in your clinic, you're a doctor, and the patient walks in with the heart condition, cardiovascular diseases, or hypertension, or diabetes, or for example, infectious diseases like COVID-19, and you cure the patient. When you cure the patient with the medicine, treatment, and health management plan, so that component is known as curative model. And then there is a rehabilitation. Like for example, if I say example, like if somebody is having cardiovascular disease and by any bypass surgery and all, and they need long term rehabilitation, long-term management plan. If you make a long-term management plan with the medicines, with the physiotherapy, with the rest, with the nutrition and everything, at home and at the family level, it is known as rehabilitation. So all these models works on personal level and rehabilitation and community level. When it talks about personal level and community level, personal level is person who has walked in, who has acquired the disease. You treat him, cure him, your job is done. And at the community level, you have to rehabilitate that person back to the society. The best example is HIV/AIDS. So HIV/AIDS, if a person acquires HIV/AIDS and all, he HIV/AIDS is a taboo, right? Social taboo. It's attached to the social taboo. The person is sick. Person for you, person is just suffering from one of the infectious disease. So your job is to cure that person, and your also job is to rehabilitate that person to his family as well as is the social environment and back into the community so that he lives his whatever life is left comfortably. So that is rehabilitation. So rehabilitation works at the personal level, rehabilitation works at the community level, treatment works at the personal level, treatment works at the community level. Prevention works at the personal level, and prevention also works at the community level. So you guys are, I should not say fortunate, but you guys are going to see a different world uh, because of this pandemic. You are living in a pandemic right now, and you are going to study a lot about pandemics, lot about infectious diseases, and in due course of time. So you will have a different kind of outlook to the health system, and the health system is also changing right now with consideration of pandemic and other things. Okay, so coming to the definition here, again all the things what we I'm going to explain, I will be explaining this whole thing in a very simplified way. I will try to restrict myself to read jargons. I will try to not use jargons, but okay. But definition is something where I should start from. But definition, don't worry about this definition. You don't have to remember it. Definition we will talk about in more formal classes, which we will have very soon. So definition of health, like according to World Health Organization, when you have seen, pardon the spelling errors here. Okay, so World Health Organization very recently in the pandemic course, you must have heard about certain agencies who are working in terms of health. Ministry of Family Welfare and Healthcare, ICMR, Indian Association of IAPSM, Indian Association of Preventive and Social Medicine, Indian Association of Epidemiologists. Then you must have heard of WHO, World Health Organizations, and there are different organizations who are working in terms of health in collaboration with the government of India and Health Ministry of India. So there is something known as Health Ministry also. So before I start anything, so our Indian health system works on three tiers. Three tier, when I say it works on three levels. One is central level, and then there is a state level, and then there is a regional level, which is also known as primary healthcare level. So there are three levels of healthcare system. It the whole system works at three level. Again, I am telling you: central level, state level, and primary means at regional level. So I'll jump to the Indian system of in India. I explained a lot earlier, but I'll be brief. Kindly, so these slides are from the previous time, so kindly correct the numbers of state and number of union territory. So when I talk about India, we should understand the country first. Each country have different health systems. Each country have different priorities for their population in terms of health. Each country have different health problems which are more or less in from the different countries. Like for example, western countries have more communicable diseases, more other health conditions compared to infectious diseases. India or developing countries have more infectious disease compared to non-infectious diseases like chronic diseases. But of course, like we are right now at the plateau where where infectious diseases are going down in India and non-communicable diseases are going up in India right now. So we are somewhere in a plateau where we are crossing this graph. I understand that you guys are very new to this medicine, but I think couple of things you easily understand. What are graphs and all and patterns? So under the Constitution of India, there are states. So there are Constitution of India. The states are largely independent, and matters relating to the delivery of health care to the people are different. So when we travel India, you must have seen India. You must have seen the map of India. If you travel from South India to North India, you can see the change easily. The weather changes, the nutrition changes, the behavior of the people changes, the language changes. Then there are their household structures changes, the socio-economic conditions changes, and there are various huge variation in rural and urban population. The way rural people live, the way urban people live are quite different. And this living lifestyle and environmental conditions coming to the collaborating with the nutrition part of it, it has a good effects on the health of the people as well as bad effect on the health of the people. There are certain things which so all the states of India have are following a cultural specific cultural pattern. So, and there are a couple of things which means every coin have a two sides. Like some of the things are harmful, some of the things are not harmful for them. So all the states of India have a different priorities of health in terms of their own state. So every state have uh, independent healthcare delivery system in India. So it is not completely independent because it all the states come under central body. So the monitoring and policy making is from the center. But in terms of delivering the health to the people or delivering any health care to the people, largely all the states are different. Like for example, Rajasthan will have a completely different set of uh, health problems than compared to Himachal Pradesh, than compared to again South India, right? Okay, when you travel every 2 hours of travel by flight, you may change your habits. People change their habits. People change their nutrition. So nutrition also have a bigger impact on people's health, and again the physical activity. When you compare physical activity of the people like Bihar and UP people, they are more physically active, they are more physically fit, they're there is more labor, they do more laborious work than compared to people in South India or maybe some other parts of the country. No offense, but it's a general picture. So their health problems will also be different. In North India they eat butter a lot, ghee a lot. In South India, at least I have seen, utilization of ghee and butter is very less. So then again, the health of the bone health there is different, bone health here is different. But obesity, if you see, obesity is completely different. They are suffering from different health problems in terms of obesity, and South India is suffering from different types of problems. Like diabetes is very much prevalent in South India, rice eating state, more carbohydrate, many other conditions favor for diabetes. North India is comparatively less, but now the epidemic of diabetes and hypertension is overall growing in all the states of the country. Okay, so I'll stick to the slides now because I have less time, so I'll try to explain everything briefly. Okay, so just to be brief, that all the states have different set of health problems and different priorities for their own population of state, and that is how they tweak or manipulate or deliver the health system in a different way. Central, when I say when I already said there are central, so it's at the three level healthcare delivery system, at the center, at the state, and at the regional level. Now, center's responsibility. What the center's responsibility is? The center's responsibility is for making policy, planning, guiding, assisting, evaluating, and coordinating the work of the state health ministers. So, when we talk about bodies of health system, there is health ministry, then there is a family Ministry of Health Care and Family Welfare. Then there are ICMR kind of bodies which are more into research, and there are other epidemiological the bodies who takes care and read about epidemiology. Then there is a CDC, Center of Disease Control. Then there is a WHO, and then there are many other organizations who works in terms of health in collaboration with the government specifically. Okay, so when it comes to policy making, there are two ways of health system works in two ways: top to bottom approach and bottom to top approach. In India, 20 years back, we can see that everything was top to bottom approach. Like for the people who are sitting at the center used to decide what kind of healthcare delivery should be given to the grassroots level at the villages. They used to decide the health priorities of the villagers and small towns, and then they used to decide the policies, and they used to deliver those health cares to the people. Later on, they realized that maybe it's wrong because the most of the healthcare systems went without utilization. So they approached bottom to top approach. So after some time, there was a bottom to top approach. Like for example, now people at the grassroots level, like Hyderabad and around the villages with the local health bodies, they decide what are their health priorities. They send the information to the center, and then the policy is made according to the requirement at the grassroots level. Okay, so this is known as policy making. We will discuss whole thing in the very formal way in the classrooms, but there is something known as policy. So they have to make policies, and then planning. Then policy. Now, when the policy is made, policy cannot be made without planning, without proper planning. So there is a planning system, planning body, planning cycle, where they plan everything, how much the fund should be allocated for this particular program, how much the fund should be utilized in a specific way, how much funds to be given to the state, and state fundings also, evaluation of state funding, and how the expenditure should go to benefit the people in preventive way, curative way, and rehabilitative way. So, health planning, it needs a rigorous planning at each level. So the planning happens at the local, regional level, planning happens at the state level, planning happens at the central level. Now, then the final policy is made at the national level. Now, I talked about bottom to top approach, but top to bottom approach, a living example is pandemic. The bottom to top approach works when government needs to make policies and law and the disease is new or epidemic starts or epidemic or pandemic starts. So when epidemics and pandemic starts, people at the grassroots level, they don't know what they need. Like COVID-19, people, when this whole disease started creeping into the countries, people of the country, those people of the country, they don't know what they need and how to get rid of this whole thing or prevent themselves or preserve themselves from getting sick. So what happened is the government decided on the policy. They evoked certain plans like pandemic preparedness plan and all those things were evoked. Epidemic plans were evoked, and they decided when the lockdown should be there. They decided how much the lockdown should be there. They decided what should be the preventive steps at the personal level, at the community level, at the so this is how all the decisions were taken. The screening, where the screening should happen, how the screening should happen, how the information should be given to the people, and all those things. So the entire policy was decided with an approach of top to bottom. Okay. Now, so you must have seen Prime Minister or Health Ministers, everybody having meetings with ICMR and Ministry of Family Welfare and Healthcare. So all these things were happening at the everything was live streamed at in last 2020, early 2020, and you must have gone through it. But I'm trying to make give you example with that so that you can visualize what happened and how the policy was made. Guiding is again a central responsibility. They of course deliver the healthcare system into the to the state level and the grassroots level, but the guidance is required for the specific skills to tackle the problem and run the program. Assisting with funds and logistics are important, and assisting with the skills are important. Evaluating and coordinating. Evaluation is very important because when the new policy is made and the policy is implemented somewhere in the region, and the evaluation is very important because you need to get the feedback that how the policy is working. So evaluation is very important, and depending on the reports and all, you can also change and do some changes in the policy. Coordinating the work of the state of Coordinating the work of the state of ministers, health ministers, like they all are supposed to give the reports to the center what and how they have implemented their programs uh, in their states. Now, health system in India is again central, state, and peripheral. I already discussed that with you. Organs of health system at the center. So, what are the organs of health system? Organogram, if you see the structures, is Ministry of Health and Family Welfare. And again, in the Ministry of Health and Family Welfare, there are different departments to tackle different diseases. Like infectious disease is different, non-infectious disease is different, and again in that there are different health problems like mental health problems. So healthcare delivery system, the entire system is based on health national and health. They're based on health programs. So there are national health programs and there are state health programs. Okay. The Union Ministry of Health and Family Welfare, the Department of Health, and Department of Family Welfare. It was established in 1966. This is the National Institute of Family Welfare. If you see, it's an old building, but if you see the recently, the building will be quite little crowded. This looks like old picture. So, what are the functions of uh, Union Ministry of Family Welfare and Healthcare? Now, how does it function? It enlists the seventh schedule for Article 246 of the Constitution of India. They are Union List and Concurrent List. So don't have to retain this. The first line, there is something known as Union List and there is something known as Concurrent List. So the Union List, international health relations and administration of port quarantine. So, international health relations and administration of port quarantines. So the function is they interact with the international health, other countries and other countries' health programs and organizations and bodies for the global health. So when we say state is a part of the country and the country's health is a part of the global health, states, again I'm saying states, population of state, if that is healthy, it contributes to the health of the country. If the health of the country contributes to the health of the world. So there are agencies, there are bodies at the global level, at the international level, where all the coordination goes. So our country, it's not like our country is the dead end that you give all the reporting to the health ministry of our country and you are done, and nobody is monitoring and nobody is making policies, nobody is monitoring, nobody is evaluating our country's health system. No, it is not true. Our country's health system is answerable to the global health system. Okay, so it is in a part of a global health, it's a part of global. When we talk about union list, there are functions are international health relations with the other countries and administration of port quarantine. Okay, so port quarantine is, again, you understand what is port quarantine, what is the quarantine. So the port and airport quarantines, the shipping port, airport. So all these quarantine measures and all these it's like a whole lot of detective kind of thing which happens there, and everybody, it means our countries are keeping a watch on their other countries' health system. Their countries are keeping watch on our health system, and if there is an infectious disease outbreak in our country, they evoke the port quarantine plans or pandemic preparedness plan, epidemic preparedness plan for their countries, so that they stop our country people to enter their country, so that the infection, their country people are protected or prevented. So promotion of so okay. The second point is administration of this of central institute. Administration of central institute. When it comes to that, uh, there's not difficult, no explanation in here. So administration of the central institute, so all the administrative part. Then promotion of research. So research is very important, because if you are not doing research, you are not getting new informations from the population, you are not getting new informations to prevent sickness, to treat people, and to rehabilitate people. So again, research happens in all three ways: preventive research, curative research, as well as diagnostic research, curative research, and rehabilitative research. Okay, so research is something which is bringing out new information and adding to the new knowledge to the medical science of and medical science, right? So research happens in all the fields, but again, when we are talking about health science and medical science, We are talking about research in our field: diagnostic researches, therapeutic researches, preventive researches, like vaccine. Like for example, vaccine. Huge amount of research went into the vaccine. Huge amount of money went into the vaccine. So for manufacturing vaccine for the COVID-19, it took a long time, and everything. Like research takes a little long time, but promotion of research is one of the thing. If research do not happen, we do not know new information about new diseases, new information about new health conditions, and we will never be able to tackle the new conditions, new health conditions, and all. So promotion of research is one of the uh, major this thing for union list in the union list at the central level. Regulation and development of medical, dental, and nursing professions. So it's not only the doctors are working, the doctors are of course working with nursing staff and dental staff shoulder to shoulder. Okay, so the nursing, it's of course it's a different branch, it's a different stream completely, but doctors without nurses can't do much. Nurses without doctors can't do much. So nursing professions, dental professions, and medical professions are integrated. It should be integrated as much as possible, but they are integrated professions, works shoulder to shoulder. Immigration and migration. They also work on immigration and migration policies. The immigration and migration policies changes time to time depending on the health of the population and requirement of the population of each country. Right. And establishment of drug. Okay. So establishment, maintenance of drug standards. Then census. Census means continuous evaluation of the changes in the population. And the population works, okay, change, yeah, establishment and maintenance of the drug standards, and census the changes in the population, then regulation of labor, mines, and oil fields, and coordination with state of promotion of health. The regulation of labor, of mine and oil fields are major important because the occupational hazards are more there. So there's something known as occupational hazard. All the occupations have some side effects, some hazards, including the medical profession, including the IT profession, and at the industrial level, of course. Industrial level, there are many occupational hazards which occur. Okay. Okay, so this is a, yeah. So for example, coal mines, if you see in the picture, it's more suffocated. The respiratory infections will be more. They are more exposed to the heat. They are more exposed to the humid areas under the mines, and also their health problems will be different. So they get those kind of things. The port quarantine, okay, port quarantine. I think you guys understand. Okay, I'm being a little fast because like time is moving. Concurrent list. These functions are responsibility of both union and state government. They are labor welfare, economic and social planning, prevention of adulteration of foodstuff, population control, and family planning. I'm not describing this. This whole thing we will discuss in our class. Directorate of General of Health Services. It comprises of medical care, public health, and general administration. When we talk about medical care, it is curative, public health is preventive and curative and rehabilitative, and includes research. And when it's general administration, it's health management and all, right? So again, I'll say medical care means comprise of medical care, curative, mostly the curative services and rehabilitative services. Yeah, and when we talk about public health, again, preventive services, curative services, rehabilitative services, and the research and epidemiology. And general administration mostly deals with the health management side. Its general functions are surveys, planning, coordination, programming, appraisal of all health matters in the country. Okay. Its specific function is, I'll explain here itself. So, doing a surveys, continuous doing the surveys of health problems. The planning, again, I explained planning already. Coordination, you guys know coordination, program and appraisal of all health matters in the country. That is the evaluation. Its specific functions are international health relations and quarantine, control of drug standards, the Drug Act in 1940 vests at the central government and with the power to test quality of improved drugs, management of medical stores, depots to supply civil medical requirements and to inquire sorry and to ensure quality, cheaper bargain and promote supplies. Postgraduate training, medical education, medical research based on Indian Council of Medical Research founded by 1911 in New Delhi plays a vital role in adding, promoting and scientific research to human diseases and causation of prevention and cure. Okay, right. So central government and there is more. Central government health scheme, National Health Program, Central Health Education Bureau, peripheral of education material for creating health awareness among poor people. Health intelligence, that is Central Bureau of Health Intelligence, which was formed in 1961 to disseminate the health statistics and epidemic intelligence to state. As I said, it's kind of detective and intelligence agency job. So we also have health intelligence agencies. National Medical Library which was constructed in 1966 to help the advancement of medical and healthcare system. Just check. I'll just check how much slides are left so that okay, not more. So not much. So Central Council of Health, which was set up in 9th August 1952 under the Article 263 of the Constitution of India by presidential order for promoting the coordination of all the health programs and measures. Its functions are to establish organizations for promoting and maintaining cooperation between the central and state administration, to make proposal for legislation for public health matters for the country as a whole, then outgoing policies in regard to all health matters and surveillance of grant and aid. Thank you. I must have gone a little bit faster after I lost time at for 18 minutes because I had to go back and explain everything back again. So this mainly this works on three levels: central, state, regional level. Regional level also comprise of primary health care, which there are centers of primary health center, community health centers. So at the regional level, so three levels and three most important thing, and the three based on three objectives: prevention, prevention, treatment, and rehabilitation. With that, I will leave you guys. Have a good day and have a nice time. Thank you. We will meet sometime soon.